Portsmouth, we went about developing community pharmacy services so that they did at least contribute to the very significant challenge we have around tackling the health inequalities in Portsmouth. So in essence, I think this is about Portsmouth's healthy living pharmacy journey. What I'd just like to do is perhaps give you an insight, some of the background and some of the ethos that we adopted in Portsmouth. Nobody starts talking about Portsmouth without giving you a little portrait of Portsmouth. There are 207,000 resident people in Portsmouth, but we do kind of spill over into the boundaries, and we have about a registered population of about 215,000. About 1 in 4 children and 1 in 5 adults live in poverty in Portsmouth, and in some parts of our city that's as many as 2 out of 3 people. Portsmouth is characterised by significant health inequalities. 30% of the men who live in the city have no qualifications, and we do have some of the worst academic attainment in our schools in Portsmouth. 40% of people still don't have access to internet, and as many as 90 different languages are spoken in our schools in Portsmouth. Life expectancy, we've done quite well with women, and the life expectancy for women is now at about the national average, but you men stubbornly refuse to budge, and we still have a significant gap, certainly from the national average and actually across the city. If a child is born in Charles Dickens ward in Portsmouth, which is one of our most deprived wards, they're likely to die now about 9 years earlier than somebody in one of our more affluent areas. We are described as a northern city on the south coast, and our ONS comparators are places like Newcastle, Sheffield, etc. So this is a map of Portsmouth, very kind of characteristic shape for those of you who don't know it. And the darker the red areas, the greater the levels of deprivation. And overlaid on that map is our community pharmacies in the city. We now have 41 community pharmacies in the city, well distributed, covering our areas of deprivation. And the people of Portsmouth are very lucky in their access to community pharmacies. And the vast majority of the population can reach a community pharmacy on foot very easily, and certainly less than half a mile to travel. So prior to starting our HLP journey, in common with what was then PCTs, we were already commissioning a range of services from our community pharmacies. But I was in the PCT then, and I knew, and other colleagues knew, that community pharmacy was capable of much more. They're capable of delivering services more consistently and a broader range of services. And at the same time, the SHA commissioned a public perception survey looking at levels of satisfaction with a range of health services. And what struck us very strongly was not the levels of satisfaction or dissatisfaction with community pharmacies, but it was the fact that people didn't have a view at all. They simply did not know what was available from their community pharmacy. And then in the last pharmacy white paper, the opportunity to develop a framework for healthy living pharmacies was offered to us in Portsmouth. So we seized that opportunity. It was a time when our then Director of Public Health was also very passionate about the contribution that community pharmacies could make. So we sort of set about defining what we thought the vision was for a healthy living pharmacy. And some of that is consistent with what every pharmacy is deliverable, so accessible, approachable. We talked about value and trust earlier today, high professional standards, working in partnership, again, something we've heard about today, with other healthcare providers. But something that we were very keen on, that they would consistently deliver a broad range of services, and in particular, that at the heart of that pharmacy, there was an ethos of promotion of health and well-being. And the thing that, as I say, many of you know, which really distinguishes a healthy living pharmacy, is that they do have an accredited healthy living champion. We set out on our journey, and a couple of things I think which were highlights for us was around the workforce development and some of the key lessons that we learned. Investing in and supporting the workforce was absolutely key. For pharmacists, that meant thinking about leadership skills, developing their teams, but in particular about encouraging those pharmacies to go out and engage with a range of partners and looking at skill mix and productivity. But I guess the real achievement in HLP was around developing the technicians and the medicine counter assistants into healthy living champions. They undertook training through the Royal Society of Public Health and had to go through an accreditation process. And they really are the bedrock, I would say, of healthy living pharmacies. The environment was important as well. We expected our public, when they went into a healthy living pharmacy, to have a professional environment, high standards of consultation rooms. We were encouraging the pharmacies to utilise IT within those consultation areas and also record outcomes. And so, we were very happy to work to use ESMAC and also following on from that, pharma outcomes, and were one of the first areas to do that, and that gave us a great overview of the services and provided some benchmarking data, and we had real time information about the level of provision of services and the demographics, most importantly, about who is being served by them. Again, really sort of on that community theme and the engagement, one of the things that we expected our healthy living pharmacies to do was very much reach out into the community. Andrew was talking about, of the community in the community, and I think this is really where healthy living pharmacies do stand out. The staff were involved in a week-long roadshow, and then they attended a range of events, highly imaginative and innovative. They went to lunch clubs, they went to Sure Start picnics, they went to sixth form colleges. Quite a popular event, I have to say, venue with some of the ladies from the pharmacies. Territorial Army, I would say probably even more popular. And a football club, highly effective at reaching out into their communities. And I think for me that's one of the things that really does, characterise these pharmacies. The staff, particularly the healthy living champions, live in the city and they are working within and as a part of their own community. So if I can just tell you a bit about some of the outcomes. I say some of this you probably are familiar with and have heard already. Smoking cessation has been mentioned. We did have pharmacies providing smoking cessation services before HLP, but their throughput was inconsistent, poor really, and with low quit rates. As part of the HLP work, we got to a position where community pharmacies are certainly delivering 25% of what was then the PCT target, doubled the number of quitters that they were delivering, and are now probably a very important part of the overall smoking cessation service. But it's not just the numbers that I think is important, it's the kinds of clients that I think HLPs sort of reach out to and the way in which they engage those patients and the public. For me, the huge big plus for HLP is the sort of value added and the fact that it is part of other services that pharmacies provide. Because you could create healthy living centres anywhere, but the fact that healthy living pharmacies are also providing medicines use reviews, that they are providing advice and support around how to use medicines, enables all of this to join up highly effectively. So in HLPs, the Healthy Living Champions were far more proactive at recruiting patients to the smoking cessation services. Healthy Weight is another one of the services that we launched as part of HLP, and we did say when we set out our vision that in future we would be looking to preferentially commission services from those pharmacies which were HLP accredited, and that's what we did with the Healthy Weight programme. Some people are very cynical about weight loss services because the results tend not to be startling, but certainly what we found is these are as good as any other service, and that we recruited 283 people last year, and of those 81 achieved their 5% weight loss. And it's very much modelled on best practice, and they had training from dietitians, and from the pharmacy-based services, people could then be referred into Tier 2 and Tier 3 services. The alcohol scratch card work, which started down in Hampshire, and we certainly adopted that very rapidly. One of the benefits, certainly of the alcohol awareness programme that we ran, was that the alcohol intervention team were really struggling to get people into their services. GP practices were too busy to refer people, but actually in a very short period of time, pharmacies had engaged with over 5,000 people to do the scratch cards and to look at their levels of drinking, and then have actually referred in over 50 people directly into the alcohol intervention team. Now, these are people who probably otherwise wouldn't have engaged in any kind of service to address their high dangerous levels of drinking. Sexual health, like Southampton, Portsmouth is also a university city, and so we have the characteristic Christmas tree as opposed to rocket-shaped demographic where you get the bulge in the 20 to 24-year-olds. So very high demands for EHC, and as Sue said, if all of the 4,000 consultations that we were doing in Portsmouth now presented at our A&E or walk-in centres, it's all that extra pressure, but also extra cost. We do have some chlamydia testing going on in the city. It's not high volumes, but one of the things that is noticeable with it is the positivity rates are quite high, which means that actually because those tests are being offered to people, usually in conjunction with an EHC consultation, these are quite high-risk young people who, again, may not have accessed chlamydia testing otherwise. We provide substance misuse services in common with other people, and whilst we were on our HLP journey, we relaunched the needle and syringe exchange, actually as a result of pressure from service users. So lots of people now being supported to consume either their methadone or buprenorphine on the premises. And I think possibly what may characterise our service slightly differently, we have put a minor ailment scheme in alongside that, because again these tend to be quite isolated, vulnerable people who maybe wouldn't access healthcare otherwise. And also the whole of the pharmacy workforce was trained so that they are in the right mindset, shall we say, to support this client group. Health checks have been mentioned, and for us pharmacies were an obvious place to cite health checks as an alternative venue that's sitting alongside GP practices, and that has been sort of rolled forward following a successful pilot, and the levels of satisfaction with that are very high. And again, coming back to my sort of theme about the added value, somebody who has their health check done in their pharmacy, they identify that they smoke or they need to lose weight or they're drinking too much, that Healthy Living Pharmacy then is obviously ideally placed to move them seamlessly across to providing that support. Some other interesting sort of spin-offs which have come from this really, I mean, and from acorns, big oak trees grow, they say, don't they? Well, I think because of the work that the pharmacies had done, particularly around things like alcohol, they're certainly now seen as somewhere which is a great place to engage with large numbers of the population. So we've now got a scheme going for certainly the distribution of the Healthy Start vitamins. And the two things for me which have really come out of actually location of public health within the local authority are signposting for carers. Portsmouth is quite committed as a local authority supporting those people who care and have significant caring responsibilities. But actually publicising that and making it known to people and encouraging them to take advantage of that was proving very difficult. So we've done some work with some of our pharmacies actually where they do signpost people because they know who is caring for other members in their family. And the other development that we're just sort of thinking about now is dementia friends, and is going to be training our Healthy Living champions to be in dementia friends, and so that our pharmacies will become places more aware of some of the challenges that people with dementia are facing. So much of what I've talked about up till now has been around those services which are commissioned by public health. I think we are in an incredible fortunate situation in Portsmouth. I still have some involvement in the sort of medicines optimisation agenda, and we are really keen that all of the good work that we've done with HLPs, the CCG is still linked into and can still benefit from. The respiratory MUR project has been talked about already, and Portsmouth was one of those early trailblazers within South Central. And we've done some work with GPs trying to encourage them to refer patients to pharmacies for medicines use review, and an ongoing challenge and an issue for us is to keep that dialogue going between GP and pharmacist, because that is the only way, in my view, that we are going to improve the way in which medicines are utilised in the city. We do have some concordant services which the CCG is going to carry forward next year as well. We've had minor ailment services going in the city for a little while, and many of you may be aware that CCGs have now had to review all the enhanced services which PCTs previously commissioned. There are some that have gone to public health and some remain the remit of CCGs. And I'm very pleased to say that there was no question in our CCG's mind about the need to continue this minor ailment service. They very easily understood that this has the potential to significantly impact on the urgent care demands, and we will be looking to certainly extend that in the city. We have done some evaluations of HLP in Portsmouth, and certainly public and patients appreciate the tailored one-to-one advice that they can access, and some of those clients have achieved great success in changing their lifestyle, and have sent in really unsolicited commendations around some of the services that they've had from community pharmacies, and these are just a few that I've incorporated here. And obviously now we have the Pathfinder sites which have been much more extensively evaluated. But I'm very, very proud to say it all started in Portsmouth. So in terms of the future, the local authority is committed to using HLP as a framework for future commissioning of public health services in Portsmouth. They're certainly looking to extend some of those public health services on the back of the popularity, the efficacy, the productivity of the services which are already being delivered. So hepatitis screening and vaccination is one of the ones which is being looked at quite closely. Andrew mentioned the importance of retaining the links with CCG. We are very well placed to do that, and we'll be looking to see what more work we can do around targeting MURs, and certainly the gentleman who asked about the discharge planning, that's something that we definitely want to focus on and try to do more with next year. So in conclusion, it's my firm belief that in Portsmouth pharmacies are definitely contributing to tackling health inequalities and promoting healthy lifestyles, and perhaps more importantly, working with those communities and the individuals to support them to do that as well.